notes before we start. Okay, so first slide, yep. So before we begin the housekeeping notes, we are delighted to offer French and English interpretation for the workshop. So please can all attendees click on the interpretation button now on the Zoom menu to select either the French or the English channel. I'm going to read this out in French as well in case our French speakers haven't seen that. So, pour écouter la version française, il faut cliquer sur Interprétation dans les options de la réunion de Zoom et sélectionner le canal français. I'm just going to give you a couple of seconds just to try and do that. If you're having difficulties, please pop a note in the chat to us and we'll be able to help you. It's important to select the interpretation channel as our speakers will be changing languages from French to English. And this will mean as an attendee, you will hear your chosen language throughout. Okay, brilliant. So next slide, please. You'll notice that you've entered the workshop with your camera off and your audio muted. So please could you keep your audio muted to help keep background noise to a minimum. If you're invited to speak, please unmute yourself by pressing the microphone button in the bottom left-hand corner, and feel free to switch on your video again by using the button in the left-hand corner. Thank you. Okay, next slide. The chat. So we have this, yesterday we were using this chat functionality within the platform, which we would still like to draw your attention to, as it's a great way of connecting throughout the event. But actually for today's workshop, we will also be using the chat functionality in Zoom. So if you have any questions during the Q&A, I would like to encourage you to put all of your questions in the chat, as one of the workshop team will be monitoring the chat and checking any questions as we go through. Thank you. Again, let me just run on. If you have any technical questions, sorry, I've just jumped a slide. So if you would like to be able to, so moving on to the next slide, Sashi, apologies. This shows you where you can have the platform chat available and also split your screen. So for those of you who would like to have two screens open, we just wanted to bring this to your attention. So you could just drag to the side and then you can look at both at the same time. Thank you. Next slide. And again, if you're experiencing any problems at all, please message in the Zoom chat box or also contact us via the platform at admin@nnnevents.com. Okay, thank you very much. Over to you, Charles. I hope the session goes very well. Thank you.
Thank you, Debbie, and welcome everybody. This session is the Enhancing National NTD Programmes and Approaches to Empowering Local Teams. And what we hope to do today is to have a conversation about the needs of programs, both now and in the long term. I'm Charles Mackenzie from the NTD Support Center in Atlanta, and I am most ably accompanied by my co-moderator, Professor Daniel Boachi from the N Fund. And just before we get started, I would like to thank the people that helped put this together: Sashi Lev, Sabrina Pasco, Jamie Talent, Sela Laskowski, and Debbie from MYT for the assistance. So thank you. And I can have the next slide, please. So we have we have three at this point, and hopefully Dr. Masitan will join us in a few minutes. But 4 distinguished program leaders from Africa for the discussion. Dr. Masitan Dembele is the NTD Program Coordinator and LF Program Leader in the Ministry of Health in Mali. And I welcome her. Hopefully she's on. Dr. Adamo Salisu, the LF and Onco Coordinator from the Ministry of Health in Niger. Welcome. And Director McCoy Samuel from the Guinea Worm Onco and LF Coordinator in the Ministry of Health in South Sudan. And lastly, and certainly not least, it's a great privilege to have Professor Mamoun Hameda, who has, as many of you will know, a distinguished record in NTD world with many positions as Onco Coordinator in Sudan, chair of the APOC committee, an educator, and a minister of health in Sudan. So I'd like to thank all the speakers for being willing to participate today. Have the next slide, please. So why are we having this discussion? NTD programs are not new. The ONCA program's been around for over 30 years. The preventive chemotherapy model has arguably one of the most successful major health interventions that has changed and continues to change provision of health to those who need health the most in the world. They're very successful interventions. Over time, since the beginning, more and more responsibility and leadership roles and leadership activities are being taken by the country teams themselves. And this is a very welcome movement. And it's examining this movement to leadership from the countries that we want to be the center of today's discussion, and to know exactly how we can help this most welcome advance. Could I have the next slide, please? So the aim today is to understand better the needs of country NTD programs as they move into stronger leadership, not just in the immediate period ahead of us, but in the long term, so that they can take over not just NTD programs, but the whole initiative set up by the PC programs, as I said earlier, is a catalyst to health for particularly those in rural and poverty settings. And we want to see how best to move to enhance and give empowerment to country programs. So the question in today's conversation is, what do countries feel they need? And that's what we hope to get out of today. You can have the next slide, please. So the way that we're going to do this today is to really address 4 different question areas and address each of these, and then have a discussion at the end. So the 4 question areas: program administration, infrastructure development, particularly looking at the long term, personnel development. I personally feel we do not do enough to look at how we can enhance the actual professional skills of people who are in our programs. And it's important to develop program teams as individuals as well as teams in a whole. And then the last one that we'll address is a more personal aspect of understanding what running these programs does to the personal lives of program managers and teams, and just discuss that to bring the meeting to an end. How will we do this? These 4 thematic areas we'll address with the 4 participants, the 4 panelists, and we encourage you to send questions and comments for each of these to, yes, you could go to the next slide, thanks, Sashi. Go to the chat box to send in any questions or comments you have. We will look at those and discuss those in the final section, so as we can move through the 4 different areas. And Professor Wachi will discuss those and sum up the main points from the meeting in our final 20 minutes today. So we'll go to the next slide, please. We'll go straight to the, go to the next slide, please, Sashi. So let's start with this infrastructure development. And by this, I'm not meaning specifically the NTD programs themselves. We have another section to discuss that. but looking at the program teams and offices and the facilities that are needed to run these sorts of programs. That sort of infrastructure is what we want to discuss in this particular section. So the question to our panelists is, what do you feel are the important infrastructure components that you need, you don't have, or feel that you will need in the long term? And is Dr. Masitan, are you with us? If you could turn on your speaker. Has she managed to join us? Maybe not yet. So maybe I could turn to you, Dr. Salisu, and ask this question of you first. Just what are the infrastructure components that you feel you need to keep your programs going? Dr. Salisu.
Merci beaucoup.
Thank you so very much. Thank you so much, Mr. Charles Mackenzie, for this initiative. And thank you to all the other participants. It is a delight for me to participate here. With regards to the needs of infrastructure, we have lots of needs. And the first component of our activities, and which is very important for everything we do, is really data treatment, information. In order to get good data today in the era of technology, what we need is the tools to be able to work on. And I'm talking about the computers. We need the computers to be able to work on data. Other than computers, we need to have a good internet connection. And this is something which we all need. Other than a good internet connection, we need tools to find data in real time. And I'm talking about GPS, because sometimes we have local data, but we can't access them because right now somebody needs to go out in the field to get that data. Or we have a mix of information, how we retrieve them. So other than this technology, other than the systems of technology, we in Niger, we are working on the elimination of different and neglected tropical diseases. And we are eliminating one, we are working on 2 others. And so for us, it is so important to have a local initiative so that we can deal with the samples locally. Because if you don't have a system in place, especially now with COVID-19, where everybody is afraid, because the samples are coming from the outside and they are afraid to deal with these samples. And I think that we need to have an operational lab so that we have ELISA and PCR capabilities so that we can locally analyze the samples and that we can get our own data. In order to analyze the samples, we also need to have trained personnel to do this work. The Ministry of Health helps and supports us, but we need to have some supplementary equipment. We need this equipment so that we can have good quality data and the possibility to work in this lab. What is the most important here? And because it is so difficult to work in a country like Niger, we don't have road infrastructure. We do not have the possibility to get our workers to the place. You need to have access to cars. The cars we have are too old. Very often they are older than 20 years. And it is important for us to have access to cars. Then we have another need. For Niger, we need to have office space so that we can have a place where the personnel can work together and also exchange information in good conditions so that they can improve the quality of their work. So these are, in a nutshell, our needs with regards of equipment. Thank you for giving me the floor.
Thank you very much. If it sounds to me like what you're saying here is that you need the ability to function independently. In other words, you need the ability to do everything in your own country. And I think that probably applies to many countries. So thank you very much for that. Can I ask the same question of you, Director McCoy, of what you feel we need? You just need to unmute. Thank you.
Thank you, Professor Charles Mackenzie, and I want to thank everyone. So I think to understand the needs for South Sudan, I think it will be a good thing to go back and try to understand the context. As we know, this is a country that is born out of decades of devastation as a result of a civil war for decades. And that led to, beside the toll on human loss, also it leads to underdevelopment of the physical and socio-economic infrastructures. It also leads to the destruction of the limited infrastructure that actually existed. And it also limit the ability to be able to build the qualified human resource for health capacity. Now, with the CPA 2005, I think that led to independence. There was optimism, there was relative peace, there was stability. The country quickly really built up some infrastructure, but then another civil conflict also ensured 2013 and 2016. And these conflicts has the negative effect of rolling back some of the gains after the comprehensive peace agreement. Now, considering that the new NTD roadmap, the ability of every country to achieve elimination targets really depends on the strength of the underlying health system. From this perspective, the odds are monumental against South Sudan, since only 44% of the population access health services. So, but then there is a good news. The good news is that the success of the genome eradication program in South Sudan teaches us the fact that it is not only about identifying your needs, but where you invest your needs. So investing your needs on community structures is a more effective and sustainable way to achieve the elimination targets. So with that, just a few things that are almost similar with what my colleague from Mali stated. At the end of the day, we have to have a situation where our presence is very close to where the issue is. And that's what we meant by investing in community structures. Because in those structures, this is actually really where you will be able to build ownership at the lower unit of intervention. And that is the household, the community. And you can move up to whatever numerical primary healthcare system exists. Now, with that, given the background of how the depth of the health infrastructure in South Sudan, we definitely need logistics. We need to move. So you need to get to communities. And sometimes for you to get to those communities, you need to fly. And sometimes even if you have the chance to fly, you may not even have a place to land. So in other locations, you need to have boats. Sometimes you even have to walk because you cannot even use a bicycle, you cannot use a motorbike, you cannot use a vehicle. So that's why where you invest to build the infrastructure that will help us to be successful is very critical. If you put it in the towns, you put it in, and then at the end of the day, you will be stuck there and you will not be able to get to where people need the interventions. That doesn't mean that we don't need those support at the other levels in the towns. Definitely we need office space, especially at the national level, for us to be able to do the necessary coordination activities. We need also to be able to see how we can build similar infrastructure at the state level and at the county level. And very key is that when we are thinking in terms of the county level, we need to get it very, very close to where interventions need to happen. Now, with that in mind, definitely realizing those infrastructure comes with the cost. And I think this is something that I think everyone, you yourself and Professor Humed here and many other people who understand the context of South Sudan, being South Sudan, understand that it is not cheap to get things to happen in those communities. And of course, it is very important that we build the capacity at the community level, where we'll be able to collect data. And with that, it means that we need to have people on the ground, people who are trained, people who are motivated, collect data with the ability to analyze data and make decisions right there. Because if you have to wait until data is analyzed at the national level, at the state level, and then by the time you take decisions, probably especially for very demanding programs like Guinea worm, that decision is really too late. And that's why getting people who have the capacity to be able to make those decisions very close to where intervention needs to happen is very, very critical. Of course, we need to be able to make sure we provide people with the tools that can be able to use for communication. I think we understand the challenge here. In the network, telephone network, even within Juba, you go out 10 kilometers or 15 kilometers, you're already out of network. So it means that you need to have a different mechanism of communication, using HF radios, using maybe satellite phones. These are very critical for you to be able to communicate with the different levels and to make sure that you're able to make the necessary decisions.
Right. So thank you for the really good point of community-centered approach. And that obviously is a challenge in South Sudan. If I could turn now to Professor Humeda to give a perspective from a ministerial level of implementing NTD programs. Mamoun? I'm not sure we can hear you. Yeah, I think you're still muted, Mamoun.
Just a quick note to say I'm trying to help from my side, but I can't quite appear to be able to do it. I'm just going to give it a couple of seconds. Ah.
There we go.
Can you hear me now?
Yes, we can. Thanks.
Okay. Thank you very much, Charles, and greetings to everybody on the panel and the staff there, and especially to McCoy from South Sudan, whom I would say that we have, after the separation of South Sudan, we have passed almost 70% of the NTDs from the bigger Sudan to South Sudan. So I'm sorry about that, but the good news is that I'm here with my colleagues who are at your service, McCoy, to help in training and to provide all the structure that you may need in personnel and otherwise. So still we feel like one nation. So having said that, I think the structure of NTDs has to be very dynamic and very changeable according to certain factors. For instance, you have to have a strong central, but I agree with the others that At the center, the strength of the central team should not be at the expense of the peripheral team, because that is where action is being taken. Unfortunately, we need to raise awareness at different levels, from the center to the periphery, about the continual importance of NTD. And so awareness is very important factor which we really need. And here we are talking about education at all levels of educating, not in service education, but also at levels down below in the universities. And as you know, Charles, we have been adopting a curriculum of CDI in the university and in Master of Public Health, which I found, and I have Dr. Noma sitting on the right of my side, maybe outside the screen. He is working in the university here. We have been providing this CDI training for master of students, and we have found that extremely very good in not only raising the awareness, but also educating the public health officers at the level of the community. I think the problem as a whole is the weak infrastructure at the end of the road. I think we're talking about villages, about cities, about the states, and these are very, very weak. From the time of EPOC, this has been the problem and it continues to be the problem. So if there is any more effort that has to be put in at the level of the down below. And how to do it, I think we have to be innovative in that by raising not only money incentive, but also training incentive, because if I feel you are training me, I will do better. The second point, which I feel is extremely important, is continuous surveillance, because the endemicity of NTD is varying from one place to another. Having lived in Sudan and maybe South Sudan as well, visiting a lot of countries, the people move continually, and diseases move with them, and ecology is changing. So I think surveillance is extremely important to see where it lies, that we have to have more emphasis. And thirdly, I think, as everybody knows, that onchocerciasis is now in Sudan. Sudan is restricted to South Darfur, which is still not clearly accessible. But we have eliminated onco from Abu Hamad, which is North Sudan, and from the eastern part of Sudan, which is declared eliminated. So we were left with a few of the NTDs, and this is need to change the map and to change the NTD emphasis on where to go. I would like to touch on something which may be sensitive, but I think some countries are relying more on NGOs. We appreciate that the NGOs are really helping us. They have been doing it before EPOC, maybe, and they have been doing a good job during EPOC. But this has sent people into sleep, some countries. And I think the role of the NVO, role of the NGOs has to be restructured in these countries if we need sustain the program. I have very bad feeling that although we brought schistosomiasis in Jazeera scheme from 53% prevalence to less than 4, okay, in 10 years, but now we are back into the 20s, prevalence of 20s in Jazeera. Likewise, you know, we have been doing this in Khartoum, and Charles knows this well, that we have been distributing praziquantel to a lot of areas in Khartoum where there is prevalence of hematobium, and now in the last 2 or 3 years is coming back. So the word sustainability is extremely important. And the way to strengthen it is to strengthen the people who are there in the primary care, setting. I think we are moving forward. or at large in the NTD arena of eliminating diseases, but I don't think it's enough. I think we are reaching a stage of fatigue, maybe, that in many countries it is now we are fatigued, and the slogan of NTD is not as high as it used to be. So I think these are just opening remarks, if you like. Thank you.
Thank you very much for some very important comments, Mamoun. I don't know if Dr. Masitan has joined us.
Thank you, Giles. Unfortunately, he doesn't appear to have joined us. We're keeping an eye on whether he does join the room, and I will, if you don't mind, I'll interrupt you and let you know he has joined.
Yes, thank you. It's a lady just to.
Oh, thank you. Sorry, apologies. Okay, thank you.
Okay, thanks. So thank you for the comments. So moving to the next section, which is really about developing the actual team members. And in other words, increasing the skills of the people in your teams. And Mamoun, you mentioned some of that in the university training, but I'm just wondering what kind of training do you think that would enhance your team so that individual team members actually better their own careers? I think it's important that individuals in your teams get personal value out of being part of the teams, and education and training is something that certainly most of us have enjoyed in our youth as part of being part of the systems that we're talking about. So my question, and back to you, Salisu, what sort of training do you think your team would benefit from? What kinds of training, and do you get that training? Can you get that training in Niger, or is it something that could be looked at as a more global training program for NTD teams? So can I ask you, Salisu, to give us your thoughts on that?
Oui, merci beaucoup, professeur.
Yes, thank you very much, Professor. With respect to capacity development and improving our team's skills, we have multiple and diverse needs. I said that we are focusing in Niger on developing our capacities locally, so that at the local level we have all the skills necessary in order to focus our programs and activities on the targeted diseases. And to do this, we need a lot of data, as I was saying earlier, and we need to have high quality data. And then our teams need to know how to use this data. So we need to have capacity building in terms of how to use data and statistics. That's one element. And that's probably one of the most important components for us at the current time. Another aspect is that even if we are able to eliminate some of these neglected tropical diseases, we need to also look at how we can reinforce other skills, as Daniel knows quite well, and others. A lot of these diseases are vector-based diseases, such as onchocerciasis. In addition to that, there are a lot of other ones that are transmitted through vectors. And in Niger, we had thought at the beginning that this disease would never come to Niger. We never thought we'd have dengue fever, for example, and then it came. So these are diseases that are also categorized as NTDs. So our staff needs to have more training in terms of understanding these diseases and the epidemiology of these diseases. Now, when we talk about human resource development, we can't simply stop with information and training. We also need to have continuing education at the local level In other words, we need to have information exchange. In Niger, we have a mechanism that we've institutionalized now, and this allows us to make sure that everybody has the same information at the same time, or at least this is what we're trying to do. We're trying to make sure that all the different people working in the field of NTDs has access to the information at the same time. So we're trying to institutionalize this, and at least every quarter, we have coordination meetings with our partners, those who are supporting us and assisting us. And we talk about all the different components of the NTD program. We're talking about the life of the program, our needs, and our future planning for the programs. In addition to that, we also have meetings for coordinating at the grassroots level. And for every campaign or every activity we have, then we talk about the needs for training, the needs for planning, and all the different activities that we'll be planning for these different campaigns. So capacity building isn't just training. As I said, communication is also an important element. We are of the mindset that in order to develop human resource skills, motivation is very important. So that's why we're also working to see how we can motivate our team members, and we can see those who are the most productive or the most effective. Then we motivate them with either little bonuses at the local level, perhaps giving them, reimbursing their school fees for their children, for example, or other small bonuses that we can give them to motivate and incentivize them. So this also has to be something that is supported by our partners, because our partners who are working with us are providing a lot of support, but the government also has to play its role. So we have regular meetings, and we will be having one soon by the end of September. So we have a lot of advocacy meetings with the First Lady of Niger, and she has set aside a day to look at different NTDs. And during this NTD day, we will be trying to motivate health workers. We will look at those who have been very productive, who've out working on the different diseases, because our First Lady is very focused on training, and she's also very interested in looking at how we can combat these diseases, especially those that affect children. Now, this training is also part of our health plan that we've developed in Niger. And it's a big priority for us, because our efforts to combat these diseases is part of a strategy that we have been working on to try to eliminate these diseases. And in the most far-flung villages, in the really rural zones, we are trying to focus our efforts so we can bring all activities and programs necessary to end these diseases, because a lot of the diseases that are in our villages are parasite-based diseases, and they are not often focused on as much, because some of the NTDs that we are focusing on, some of the medicines to fight these diseases there aren't medicines that are available in all the pharmacies, or even the pharmacies in some of these villages or rural areas. So these are all components that are very important. And whether they are parasite-based diseases or other diseases, we need to be able to make sure that people have access to medicines and treatments. So in addition to this, we have another important area that we want to continue working on, and that's working at the morbidity load. And in order to better register morbidity rates, we need to have more technicians who are trained and who understand how to do this work. We have surgeons who are there and who are trained, but as we're building their skills, we're trying to also work with other countries like Mali and Burkina on some joint projects where we bring in well-known, renowned surgeons from Mali, for example, who will come and work with our local surgeons and to train them, and they'll have an exchange, professional exchange and training. So these are some of the elements that I wanted to raise in terms of personnel development. Thank you very much.
Thank you very much, Salisu. McCoy, I know you have you are a teacher, so you must have some good comments on this, with your teacher's background.
Thank you, Professor Charles. And yeah, the issue of personnel development, this is very, very critical. Again, taking you back to the context of South Sudan, where, and I think partly also, I think the point that was raised by Professor Mamoun Humeida is a very critical point that should be a point of initiating a conversation about how to address the issue of human resource for health in the setting, in the context of South Sudan, because to a greater extent, health service delivery and most of the health workers are actually recruited by NGOs. And it created a situation where people are leaving Ministry of Health establishments to go and work for NGOs. But that is not sustainable, because at the end of the day, you need to be able to, the few human resource qualified ones are always drained because they in search of greener pasture. And that leaves the Ministry of Health establishment at all levels perpetually weaker. So that drives me to the point that talking about the personnel development, it starts to the point of recruitment. Until you're able to recruit people, and then the idea of training, it becomes a second thought. But then if you can train people, and then also there has to be the ability to retain them. And I think that is actually the biggest point that we struggle as government to retain qualified staff. And then now comes to the issue of the training itself. And I think in the setting of South Sudan, it is important that we need to think in terms of customized training. Because at the end of the day, it is about not only training for the needs, for the required needs, to instill the necessary skills that the team needs. But also we are looking at different levels. You need almost training at different levels depending on the different structures that you need for a smooth functioning NTD program. At the national level, at the state level, at the county level, at the community level. Every level needs different, they have different needs, and for that matter, they need a customized training. And that is also based on the ability of the trainee to observe, to absorb the knowledge that is being provided. So that's why the importance of customization. Because if you go to the lower level, there are areas where it's so challenging to bring people from other places, and there are very few people to train in those locations. So that will not mean that you have to do nothing or continue to settle down to bring people from other areas to work in those areas, because it will never be sustainable. So you have to be able to build a mechanism to build up a customized training, where now you'll be able to see how you can actually build a career path for people who may have otherwise a very basic educational background. And I think that is very, very critical if we have to build up the necessary platform to be able to roll out the necessary implementation of NTD programs across the country, and also to ensure universal health coverage. Now, I think Professor Mamoun Humeida raised a very important, and the role of the institution, his institution in Sudan, which has contributed really so much in building up capacity, especially mid-level capacity and even high-level leadership capacity for people who are working in the NTD fraternity. And I think we need also to be able to look into similar endeavors where we identify training institutions within the country so that they be able to customize trainings that suit the needs of the different levels of human resource that we need at different level. And again, going back to the fact that at a certain level, you need those specialized training. And I think with us in South Sudan, and especially with the gracious offer from Professor Mahmoud Humeda, we will need our doctors, our surgeons to have some of those specialized training so that they can be able, for instance, to do hydrocele surgeries and also do other surgeries. For instance, for TT, we have been struggling to train enough TT surgeons so that we're able to meet our TT targets, you see. So we believe that we can be able to coordinate with the, for instance, Mahmoud Humeda, and definitely he's always gracious to help where necessary, to be able to make sure that we also, and we have the Association of Ophthalmologists in the country. They are very motivated, they are very enthusiastic, they want to support in any way possible. So I think we have the opportunity to liaise with the training institution here. University of Juba is around, you have University of Bahr Ghazal, you have University of Upper Nile, you have other universities that have also come up, and we have other training, mid-level health training institutes. We need to be able to really integrate the CGTI philosophy and approach into to mainstream in all training institutions in the country. That will be the local capacity. That will be the local capacity that we need to continue to identify the needs of our human resource at the different levels, and to provide the necessary customization and the necessary continuous training and mentoring.
Some great points you made there, McCoy. And I think, Mamoun, I'm wondering if you can see a way that what you've been doing with the senior levels of the medical system in training in your system, your university, do you think there's a way that we can get the training that McCoy talks about, systems set up across Africa, really, and across the NTD world for what was pointed out earlier on as the key place, was the village level individuals. So as McCoy says, getting the training down to the level in the right way to the level. What are your thoughts about that, Mamoun?
Charles, if I could just very briefly interrupt and just let you know we do have another speaker in the room. So I just want, I don't know if it's appropriate to now just...
Master Dan is now here, yes.
Master, if you could kindly share your video with us. Let me just try to unmute you. I've got two, so I just would like to just double check. If that's possible. I'm just going to try again. Okay, Master Tan, if you have joined us, please could you kindly just unmute yourself and let us know that you're with us. Okay. I'm asking through the controls to start the video and unmute, but unfortunately we're not hearing anything. So maybe we're still experiencing technical difficulties. Perhaps after this next bit, yes, I can try again. Thank you.
Right. So Mamoun, back to you, please. You're on mute. There you go.
We are okay. Okay. The training of country across the country and from country to country is pertinent. I just want to take this opportunity to assure McCoy that our institutions here in Sudan are ready to train, and we have already been training master degree in public health. We graduated more than 7 master degree in public health from our brothers in South Sudan, and likewise with laboratory technology. So I'm just offering this. But I agree with McCoy that we really need to tailor the training. We have an experience here of midwives. We have been training midwives to do other things, okay, like picking up trachoma, midwives, because these are the doctors of the village. They are available there, they do a lot of work. If they do it good, they do good for health. And if they are deviating from the health, they do bad. So this is a type of persons we need to train. But these people need recognition. And one of the recognition is not only money, but certificates. If you give them 3, 4, 5 months with a certificate, which is recognized by university, they get enthusiastic about it. And we have been doing this with CA breast, cancer of the breast. We trained quite about 400 or 500 midwives to pick up early cancer of the breast. And it worked very well. We can do this for NTDs, okay? And they can help. So training tailored is extremely important. And cross-country is, again, is feasible, especially with countries like Sudan, which South Sudan, which has been one country.
Thank you. That's great. Let me just check, is Dr. Masitan, are you with us yet?
Vous êtes là, Dr. Masitan, vous êtes là?
Dr.
Vous pouvez
Masitan,
parler,
are you
s'il vous
there?
plaît?
Can you speak? Can you unmute yourself and speak to let us know you're there? Dr. Masitan?
Si vous pouvez partager votre vidéo,
If you could turn on your video, please.
From that, yes, she used to come. Submitting yes.
We're still experiencing a few technical difficulties, I think.
Okay.
We'll keep trying via the chat. Je vais essayer de vous envoyer un message par le chat, s'il
I'm
vous
going to
plaît.
send you a chat
Merci.
message, Dr. Masitan.
So we have about 35 minutes left, and before we sort of open to questions to the non-panelists, I just wanted to cover an area that we don't often talk about, and that's how the NTD programs actually affect you as program managers, leaders, and your team personally. And I just think it's that we need to also remember, as we are with the training issues that we just discussed, that NTD programs are difficult to run, and I think it's sometimes we forget the pressures that you have in your own lives, in your own families. And one area that I always concerned about is that we know that a number of people have lost their lives carrying out in the last 33 years the NTD programs, and we rarely remember that, I think, as a global program. Sometimes we do. But so I would like to just ask you what you feel as program leaders personally. So this is a personal question. Are you proud of what you're doing? What do you personally gain from doing these programs? So a little look into your own personal lives, if we may peek. Salisu, are you happy with it, or would you rather, I won't ask you the question of whether you would rather do another job, but how does this work? Go ahead.
Ça, c'est vraiment une excellente question.
That's really an excellent question. It's an excellent question because, and let me tell you a little bit about my background. I was working with the malaria program for many years. And then I was asked to come join the NTD program. And it was a program that was evolving and just being set up at the time. Now, in terms of some of the different diseases we've been working on, what really motivated me to work in this program is that there was a member of my family who died of one of these diseases, of LF. And so at the time, there were no solutions for him, no treatments. And this was something that happened in the village, and it was a village that really didn't have a lot. There were not a lot of facilities. And so this to me was something that really motivated me. And I wanted to contribute. I wanted to do something to make sure that this type of thing would not happen anymore to people who are suffering in these areas. So what really makes me the most proud is that in Niger, we have been putting this program into place, and since 2010, we've been working on the program, on our surgery program. And this is something that has been very helpful to many people. We brought joy to a lot of people's lives because of the treatments. And so this is something that really I find very personally satisfying. For example, when I saw somebody who, for example, went out to pee, and excuse me for saying this, but his pee he was able to pee in a stream rather than in just a trickle, for example. So I can't tell you how happy he was after he had received this treatment, because he had 3 wives and he was not able to have satisfaction with any of these 3 wives. He was not able to have relations with these wives. So for him, after receiving the treatment, it was very moving. And it was just really wonderful to see this. So my greatest source of pride is to be able to contribute to bringing joy to people, to people's lives, and to help improve their living conditions. My second source of pride is that when we started this program, we had lymphatic filiosis programs, LF programs that have been in place for a short time, but we've been able to work on these parasite-based diseases. And when somebody, for example, had excrement with these worms in them, and you saw that then this was no longer the case, you felt that you were doing something useful. So I have a lot of personal pride, a lot. But this is, of course, something that often has consequences on the personal level and consequences on your family. So just to answer your question more specifically, Dr. Mackenzie, we have to we see that sometimes we have to work very late in the evening. Sometimes we're coming home really late. And sometimes my wife is not happy when I'm coming home so late at night, sorry. And this is what creates a lot of frustration sometimes. So that's one of the negative consequences of this work. But it's very important to be motivated. My motivation is that I want to continue contributing to the development of my country. And to do this, though, we need you. We need our partners. We need to work together to accomplish these goals. But of course, this work is very difficult in the field, especially in our context, with the issues of insecurity and issues of kidnapping and other safety issues. Sometimes our vehicles are stolen. Last time we went to a village to do one of our investigations. And this was a program where we were working and we didn't even sleep that night because we spent a lot of time traveling. And we got a message from Boko Haram saying we should leave the village because they said, we don't need any health workers here. The health people can't bring anything to us. They can't contribute anything to us. So leave the village. So we were afraid to leave the village that night because we were afraid we might run into them along the road. So we stayed awake until the morning. And we were too afraid to sleep. We stayed awake until the morning and we could leave in the daylight. And we have health workers who have been kidnapped because if they're out doing a vaccination campaign or something else, some other activities, there are sometimes terrorists who come who think they have money and they will kidnap them and hold them for a ransom. So we have a lot of problems, and we have also issues with not having enough medicine. And sometimes they steal the medicine, but then when they realize that medicine's not actually going to help them or be useful for them, then they just throw them along the roadside. So there are a lot of issues involved, but I'd like to take this opportunity to say thank you. Thank you to all of our partners, those who are providing medicine for us free of charge. And because I am saying thank you to all of you on behalf of those who don't have a voice, who can't say thank you. So I don't know if you realize how much this helps us or contributes to us. At the beginning, we were worried about always having enough medicine, whereas we have some people who aren't able to access the medicines, but we are having more and more support in order to be able to bring these medicines to people. And since this program has been started, since it's been implemented, we have been well received in the villages. People are now happy to see us, and they smile when they see us coming, and the village chief will come and shake your hand, and they realize that you're there to do good and to help them. And this is something that's always a pleasure for us, despite the security issues. That's what I wanted to say.
Thank you.
Thank you very much.
Thank you for your thoughts. McCoy.
Charles, if I could just interrupt briefly, please. Mata-san is in the room, I believe. So we've been exchanging a message via the chat. So vous êtes en sourdine maintenant. Est-ce qu'on peut vérifier que vous pouvez parler, s'il vous plaît? Mata-san, si vous êtes là, vous pouvez...
Listen, if you are there, you can let us know. Please say something.
Vous pouvez parler peut-être?
Oui, bonjour.
Yes, hello
Chère
everybody.
assistance, je suis là.
I am
Je suis
here.
disponible.
I am now available.
Welcome, Masitan. Sorry you've had troubles. As you know, we're quite a long way into the conversation, but let me bring you into the conversation we're having at the moment, and that's about the personal effect of the programs on your life, on your family's life. We just had a personal comment from Salisu, your colleague in West Africa, about his joy that he gets from the program. So if I could ask you to tell us a little bit about how the NTD programs that you oversee, what gives you pleasure out of doing these? What are the problems that you have in your personal life? So this is a personal view of being involved in the NTD programs.
Je peux parler?
May I speak?
Yes, please do. Sorry. Go ahead, please.
Bonjour tout le monde, bonjour chère
Hello,
assistance.
everybody.
Mon intervention, c'est surtout par rapport au développement des infrastructures. Les principales compétences, aptitudes que les programmes ont besoin d'aujourd'hui vraiment pour aller de l'avant.
I would like to talk about programs
Vous savez, les
which
MTN
need to
ont
go forward.
évolué.
You
La
know, we
lutte a
have
évolué au
lots of
Mali depuis
progress
très
with
longtemps.
the entrance
Aujourd'hui,
in
surtout par
Mali,
rapport aux maladies,
especially today,
maladies tropicales négligées à chimiothérapie préventive,
to the
notamment les
preventive
trachome, la filariose
diseases,
lymphatique,
especially with regards to
l'onchocercose, les
trachoma,
schistosomiases, et les
FL,
joelmethiases, les 5 maladies à
schistosomiasis.
chimiothérapie préventive.
We
Nous
do a
nous
lot of
glorifions des
work
bons
with
résultats
regards to
obtenus aujourd'hui parce
prevention.
que nous évoluons vraiment vers la phase
And
d'élimination de ces différentes maladies.
are on the good way,
Mais
on the
nos
good route
préoccupations
to
par rapport
eliminate
à
these diseases.
l'élimination à long terme des
But
maladies
when we're
tropicales
talking
négligées,
about elimination
c'est que
in
les
the
études ont
long
montré
term,
que
what
seul
the
le traitement de
studies
masse
showed is that
ne
only
peut
mass
pas
treatments,
maintenir
distribution
l'élimination
of
à
medication
long
in
terme.
mass, are
Il
not
faut
able to eliminate
d'autres
these
solutions qu'il
diseases
faut
in the long term.
envisager.
So we need to have other solutions.
Surtout, la première préoccupation, c'est de maintenir les acquis, les bons résultats. Pour pouvoir maintenir ces acquis, les bons résultats où nous sommes à la phase d'élimination, il faut l'intervention d'autres structures, c'est-à-dire les activités intersectorielles et multisectorielles. Nous avons besoin aujourd'hui d'une collaboration multisectorielle, notamment l'éducation, l'eau, l'hygiène, l'assainissement, pour vraiment maintenir ces acquis à long terme. Nous avons également besoin du renforcement des compétences, surtout en matière de laboratoire, pour vraiment la vérification de nos données. Nous avons besoin de la formation des entomologistes. Il y a très peu d'entomologistes au Mali aujourd'hui. Et ça, c'est un aspect très important, vraiment qu'il faut tenir compte par rapport au maintien de l'élimination à long terme des maladies tropicales négligées. Également, il faut tenir compte de la collaboration interpays. C'est vrai, le Mali est en avance aujourd'hui par rapport à beaucoup de pays voisins, mais comment collaborer de telle manière qu'entre les différents pays, vraiment qu'on puisse maintenir les acquis, qu'il n'y ait pas de recrudescence de la maladie. Pendant que nous sommes en train d'éliminer, d'autres n'ont même pas démarré et il y a des districts voisins des pays endémiques aujourd'hui.
Apologies. I don't know if you can hear me okay. We seem to be having a slight problem with the interpretation on the English channel, and we can hear both the English and the French at the same time.
This is the English interpreter. I believe that the lady has not enabled the interpretation. Therefore, she didn't receive my question in French before.
Okay,
I think joined.
All attendees, I believe, can hear both, that are listening on the English channel appear to be able to hear both. I don't know if that's a setting. Is that correct, Charles? Are you experiencing the same?
That's right. It's very hard to discern the two.
Okay.
They're both coming through. Dr. Masitan's words and the English translation are coming at the same time.
S'il vous plaît, je vais parler doucement pour que vraiment
speak slowly.
Les participants puissent comprendre mieux. J'ai été un peu rapide en parlant. Il faut aller très doucement. Merci. Oui, moi, je mettrai l'accent surtout sur l'analyse des barrières.
Okay. Masitan, est-ce que vous pouvez cliquer sur interprétation et sélectionner la langue française. On peut vérifier si ça marche ou pas, s'il vous plaît. Vous avez bien trouvé l'interprétation? Oui? Oui, parce que ce qui se passe, on peut entendre l'anglais en même temps que vous parlez en français. Je crois que c'est peut-être ça. Donc, c'est interprétation dans les options de la réunion de Zoom. Charles, would you like me to just wait a couple of seconds and see if we can get this working?
Just a couple, yeah, and then we might move to the summary period.
Okay.
We do have some questions.
Yeah.
Okay,
so
I think we...
Should we move ahead with some questions? And see if we can include Dr. Masitan in the questions. So Daniel, please hand over to you to pose the questions of the panelists.
Yeah, the first question that we have is from Adrian, and Adrian sort of wrote that you have all mentioned the need to develop activities in the most isolated communities. Primary healthcare is a mechanism.
We don't appear to be able to hear Daniel at the moment.
Okay. Can you hear me?
Can hear Daniel?
I can hear him.
Okay, that's fine. Okay, brilliant, thank you. Apologies.
Okay, can you hear me now?
Salisu, Mamoon, can you hear McCoy? Can you hear Daniel? Just wave if you can.
Moi, j'entends bien l'interprète. J'entends l'interprète et j'ai même entendu la voix de Daniel.
I hear the interpreter, and I also heard Danielle.
Oh.
And she said, "Can you hear me?" The interpreter.
Well, the first question comes from Adrian, and he wrote that you have all mentioned the need to develop activities in the most isolated communities. Primary healthcare is a mechanism to deliver healthcare to these communities and develop CDI. However, often we still try and run NTD programs in parallel. How do we build capacity and integrate programs into public healthcare to develop effective and sustainable programs, and not just train at higher levels? So the question is, how do we build capacity and integrate programs into public healthcare to develop effective and sustainable programs, and not just train at higher levels?
Can I ask Mamoon to, I think this is one for you. If I don't, sorry, Daniel, I think that's probably Mamoon.
Yeah, you should go ahead.
Muting.
If you could just unmute yourself, please.
Mamoon, you're muted. Thank you.
The first step is to strengthen the primary healthcare itself, because if you don't have a strong primary healthcare or even a skeleton healthcare system, you cannot build anything on that. And we had experience, maybe limited experience in Khartoum area, where we have developed quite well the primary healthcare in the distal areas, outreach areas, and that worked very well for NTD programs. So that's number one. Number two is you have to be innovative in involving like CDDs, like involving other people and train them to get them stable in the areas. One of the problems is the distal areas in communities is that they are not stable. They search for food and they search for money, and they are mobile from one area to another. That's, I think if you can settle that with some training and some dignified job, I think they can do the work with other aspects. But that will remain the most challenging question to settle before we can say that the program is sustainable. I agree with Adrian, that has been through the years is the problem.
Okay, Charles, are you asking another panelist?
Yeah, I don't know if Masitan has an answer to that, to bring her into it. You might.
Oui.
Otherwise, okay.
Merci beaucoup.
Yes, thank you so much. Thank you for asking this question. How do we integrate the NTD programs into primary healthcare systems, and how can we make these programs sustainable? It is true that in Mali, this is already the case. NTD programs are part of the primary healthcare systems. One needs a lot of advocacy work before the government, so that the government gets aware that this is so important. This is not obvious in many countries. Obviously, you need to have also factors which help you out to do this integration. You cannot just go ahead and integrate. You need to have the necessary resources. So you cannot just put one program in another one and then think that this will work out. First, you need advocacy work. You need to have a consistent document, a consistent message also. You have to train the actors. And you have to have a situational analysis. You also have partners in the countries. You need these partners before you can talk about integration. In the beginning, we had this vertical program and we worked with partners. These partners all worked together. They collaborated with regards to directives before the integration happened. And then you need to have human, financial, and material resources. You need these resources before you can go ahead and integrate. It is important that all of the partners work together so that we can have a vertical integration. It was easy for us at a certain point, but that's because we did a lot of collaboration. You need to have frameworks. You have to have collaboration and integration frameworks today. These integrated programs are part of our on the national level as well as on the community level. We have healthcare centers a little bit everywhere, and the coordination is done at the regional level. Capacity building is done on every level. We have focal points for NTDs in every sanitary district in Mali, in every community, in all villages. We have community relays, health agents who help us manage. We have the directors of these healthcare centers. These are all employees of the government. They are state officials, and they help us organize the activities. They are part of this endeavor. Once you have the integration in place, then you need resources for all of to manage all of the diseases, not only the NTD programs, but all of the diseases. So it's important that you have the financial resources which need to go for integration and also for management of the other diseases. So we had this advantage that the government supported us so much, and all the actors were able to coordinate together with us. And therefore, we had more facility than other countries with our resources to integrate the NTDs. We had good results because we did the integration. And it was less costly for us because we had this vertical program in place. These are some of the ideas which led us to the integration in Mali.
Thank you. Thank you very much, Dr. Masitan. Daniel, do you have another question?
Yes. Yeah, the second question is from Joyce, and she writes, it would be great to share experiences of how the community structures have been sustained over time, especially where this is working. Retaining a critical mass of well-trained community health workers or drug distributors can be challenging. Great to hear how these models are working and being sustained, as well as linkage to the formal health system, which is a bit similar, close to the first question. So maybe you can ask McCoy and Salisu.
Yep. Dr. McCoy?
Thank you, Professor. I think this is a very important question. I think there are lots of examples to give. For instance, with the Genome Education Program, there are counties, I want to cite my own county, Tarkeka, which is something like about 53 kilometers north of Juba. This is a county when we started the education campaign in 1996. There was basically one medical assistant. There were about 2 nurses, and in a population of over 200,000 people. So these are the only health workforce that we had in 1996. So we had to build up the vast network of volunteers across all villages. Many of the health facilities now and the health workers who are now working in those areas are people who started as Genome volunteers. And in the process, they were able to provide tailored training. And actually, when we started to do that, we do the tailored training with the focus on building up providing a career path for these volunteers. And many of them, from being Genome volunteers, receive training as community health workers. And then they start working at the level of running primary health care units. And then from there now, and as a community health worker, he was already given salary from working as a volunteer. And the best performing after interrupting transmission in their villages and going through the time that we know that we have already halted transmission in those bombers, we started now to prepare these people so that they become part of the health establishment. And we find opportunities for them to be trained as community workers. Some of them are trained as village midwives. Some of them are trained as TBAs, depending on the absorption of the knowledge and also the age, whether they are trainable. So many of them already now start to get into the formal system. And then they start to get salaries as either community workers or village midwives. And some of them were able now to do their work and also roll into some adult education classes. And then from there now they improve, and then some of them have gone to be trained as nurses. And then from there they became, and actually at one time, one of our volunteers became the state minister of health, a volunteer. From a volunteer, he has progressed to become a state minister of health in one of these states. So there are actually ample examples of how you can be able to build up this volunteer network. The key thing is that you need to customize training. You need to be able to identify the needs and the ability to observe the training, and make sure that you do this with the knowledge, with the direction to build a career path for these volunteers.
Thank you. Thank you. We have just 5 minutes left, and I want to give time to Daniel just to make a brief summary of the main points that he's managed to capture from the last very, very detailed discussions we've had. So Daniel, over to you to summarize.
Charles, you give me I think I opted for the most difficult part of the job.
Of course.
Well, what I've put down in terms of the responses that were given, in terms of the infrastructure development, one of the things, or some of the things that came out of was the issue of being able to collect data. And so facilities and capacities that can help in getting data was one of the key things that was mentioned. And especially in the context of McCoy, we should look at his presentation in terms of the context of a civil war or a country that has been destabilized for some time. And there are many countries like that on the continent. And so I think this is something that goes for most of those places. You have human resource challenges, and the health system is weak. And so there is the need to invest in community structure so that you get the presence of health personnel at the areas of greatest need. both Niger and then South Sudan, there was this issue of transportation that was mentioned. And so this is something that needs to be taken into account because they need to be able to go and supervise all these facilities. There was also the issue of being able to do activities in country, for example, processing of samples. And so having a laboratory that is in country is very critical if we're wanting to get countries to own their programs. And we have Professor Humeida reminding us that to be able to do this, we need to have a flexible and dynamic program. And therefore, we should be able to strengthen from the central level to the periphery. We need to have education and also public awareness of the health officers as well. In most of these places, there's still the weak health system, as was mentioned, for South Sudan, and therefore training was very critical. And the training should not be of just people at the national level, but right down to the lower levels. He did mention also that there is the need for continuous surveillance because of the movement of people and also movement of, say, vectors. One of the things that he mentioned, which sort of comes to an important aspect of what we're doing, is relying too much on NGOs. And he did mention that this has led to apathy, and therefore we need to have this looked at when we're building capacity. Because sometimes, even when you build a capacity, because of the need of the NGOs, most of them will still leave the ministries of health or the health services and join the NGOs. We came to personnel development, and coming back from what was mentioned by Professor Humeida, in Niger, they did mention the need for a biostatistician, which is still something related to proper data handling. And then also the need for medical entomologists, which was also mentioned when Mastitan came on, because we are becoming a dying breed. There is the need for in-service training. And so, as mentioned by McCoy, the training should be customized. So it's not just having the classical training of, say, an epidemiologist or an entomologist or a parasitologist, but to actually look at the needs of the program and try to tailor-make some of these training programs. And it should be at different levels, from the national to periphery, which has been mentioned much earlier.
Daniel, we've got 1 minute. Sorry.
Okay. And the other thing is career path development. And this comes to also answer some of the questions. And then the program manager's satisfaction is being able to have results that make families very happy. I think I would just end with this one so that you can go ahead and say thanks to all.
Yeah. So we're coming to an end. We will be continuing this conversation, but thank you to the speakers, the panelists, very much. And we will look at all the questions. So thank you to everybody, and end of the session. Thank you. Goodbye.
Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you to everybody. We'll now close the meeting and hope you have a very enjoyable rest of the conference. Thank you. Bye.
Bye.
Bye.